Hi everyone. Today I will be teaching you how to assist your child if they're having trouble with the T, the D, and the L sounds. If you've noticed, the T, the D, and the L all are produced in the same place in the mouth. So how I would instruct the child, I of course would use a hand mirror, and I would sit the child next to me so that they can get the visual feedback of what the sound looks like in their mouth. And so I would teach them that the T sound, what your tongue does is it touches the back of your top teeth. And then I would point. Right there, I'd point to it in my mouth. Can you touch that part in your mouth? Right behind your top teeth. Very good. For some children, if they're having difficulty being able to touch that point in their mouth, you can touch it with your finger if you're the parent. If they're comfortable, you could touch it with a lollipop. You could put some peanut butter there and have them lick it off. These are all different strategies and techniques to help them understand where the placement is. So I teach them that for the T and the D sound, the tongue is repeatedly hitting right behind their top teeth. So and the difference between the T and the D sound is the T has no voice, or your vocal folds don't move when you're producing it, but the D does. So if you take your fingers and you put them here and you go t, 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 and you tap, you don't feel this part of your throat vibrating. But when you put your fingers here and you do the D sound, d, 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 you do feel your vocal folds vibrating. So that's the difference between the T and D sound. With the L producing that same area, it is just held out. We don't usually go la, 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 la. We go l. So I show them that too in the mirror while they're sitting next to me. L. So today we'll focus in on the L sound, but these strategies will also apply to the T and the D as well if your child is having difficulty producing those sounds as well. So for the L sound, say your child is having difficulty producing the initial or the first letter in L words, like ladder. Instead of saying ladder or lamp or light, they say yite. They sort of glide into it. What you want to do, what I do first, is I teach the child how to produce the sound in isolation first. So with the mirror, I show them my mouth first, and I say, to do the L sound, you have to put your tongue behind your top teeth, and then you produce the sound. Ooh, ooh, ooh. Now you try that. And in the mirror, while I'm watching them and they're looking at themselves, they're producing the L sound. Once your child has the L, the T, or the D sound in isolation, then you can move on to the next step. The next step is to produce it in syllables. So here, if they're having difficulty with the initial L sound, then what I do is I approach it at a syllable level. So A, E, I, O, and U. I first would start with lay, then lee, then lie, then low, then loo. So I'd go, let's produce this first syllable, lay. Watch me. L, A, L, A, L, A. Can you try that? And then allow the child to do L, A. And then let's put those two together. L, A, lay. You try that. L, A, lay. Very good. Let's try another one. L, E, lee. L, E, lee. You try that. Yee. Oh, that was close. I heard you go yee, which is your old way. Let's try your new way. Make sure you're lifting your tongue behind your top teeth like this. L, E. Try it again. Lee. Yay! So if the child produces it in error, you want to tell them what you heard and then encourage them. That was the old way. Let's try the new way. being patient with them. Some of these sounds for students, it takes them less than no time to get them, but a lot of other students, it takes them a lot longer to learn how to produce these sounds. And repetition is key, practice is key. Make sure you're practicing at least 5 minutes a day with your child to supplement what they are learning in speech therapy with their clinician. So once your child is able to produce the initial L sound in the syllable, at the syllable level, then you move on to words. So words like light, lamp, lizard, all of these would be on your list. So you'd have a list of L words, initial L words, and then you'd do those. So let's try this word, lizard. You're not paying attention to how they produce any of that. So say they have the R in lizard errored, and they say lizoid. You don't pay attention to the R, you're just focusing on the L. Lizard. Can you try that? Lizoid. Yay! Good. That was a great L sound. And then you do the rest of your L's, and you want them to be able to produce each word at least 3 times. So lizard, lizard, lizard. And then once your child has mastered 80% of those words on that list, then you can move on to sentence level. So depending on their age, you can either create the sentence for them or you can have the child create a sentence. So if it's a younger child, then you may want to create the sentence for them. The light is blue. Can you try that? The light is blue. Or the light is on. Can you try that? The light is on. And you're focusing in on how they produce that L sound, and you're giving them feedback based on that. So after your child is able to produce it in isolation, in the syllable level, in sentences, then if they're old enough, they can go on to reading books and stories that have L sounds in them, and you're just focusing on those L sounds. And then, of course, into conversation. Can they produce that L sound just when they're talking with you? Okay, the same way that you produced or looked for the initial L sound, if your child is having difficulty with the medial L sound, say like a word like balloon, they're saying bayoon, you would do the same thing at the syllable level. You would have them produce these. So, A, lay, E, lee, I, lie. And you would do all of these until they are able to master producing these at the syllable level first. At least 3 times each time you work on them. And then you move on from L sound in the middle of syllables to in the middle of words. And then if your child is having difficulty with producing L's at the end of words, like ball, it's ball, with no L, then you would teach them how to produce the syllables with the L's at the end. So, ale. Can you try that? Ale. Eel. Can you try that? Eel. And then you monitor that way. And you do that for all of the sounds that your child has an error. And the same process it would be for the T sound, modeling it to them and showing them that in the mirror. The D sound, D, and the L. So if this video was helpful for you in helping your child to continue to make progress with errored sounds, give this video a thumbs up. If you have any comments, leave them down below. Like, share, and subscribe my video to my channel. Have a great one. Bye.